side of the QHRN. I was involved in running the seminars about 6-7 months ago, so it's nice to deliver one. So yeah, I'm going to talk today about some work that I've been doing as part of a clinical trial, which assessed the effectiveness and implementation of singing groups for mothers with postnatal depression. So I'll introduce a little bit about the findings from that trial, but given we are a qualitative forum, I'll delve a little bit more into the qualitative findings, which were really about unpacking what it was about the singing groups and how those singing groups supported mothers with postnatal depression. So the reason for this study is that postnatal depression affects around 25% of new mothers in the UK. And previous work has found a number of barriers to accessing treatment and, thinking about more traditional treatments such as psychological therapies, antidepressant medications. And these barriers really exist because mothers feel stigmatized sometimes in coming forward, feel fearful about disclosing mental health problems at what is supposed to be one of the happiest times in their lives, that they've become a new mother, and there's an expectation there. There's also concerns that medication might interact with breastfeeding, so some women feel reluctant to take those medications and sort of speak about that with health professionals. So alongside this, we have a growing evidence base for arts and health. We see lots of creative health programs now being tested and evaluated in different populations. And group singing is particularly powerful in supporting mental health and well-being. And a trial conducted in 2018 found that a particular singing group called Breathe Melodies for Mums was effective in alleviating postnatal depression symptoms among new mothers. So it's this programme that we've then taken forward to evaluate in a sort of larger effectiveness implementation study to really understand how it can be embedded within clinical care. So the study was called Shaper PND, so that's around scaling arts interventions into research practice, into clinical care for postnatal depression. It's a hybrid implementation effectiveness randomized control trial, as I mentioned. So the clinical outcomes were around maternal mental health, things like bonding between the mother and the infant, and stress responses, which were measured through cortisol samples. And we also assessed implementation and cost effectiveness of the programme. We recruited 199 mothers who reached a threshold on the Edinburgh Postnatal Depression Scale of greater than 10, alongside their babies. And we randomised them to either receive Breathe Melodies for Mums singing groups or treatment as usual. Sorry, not treatment as usual, active control groups. So the active controls were signposting to other groups that didn't involve singing. So things like baby yoga, play activities, and we basically had a list that mothers could choose from. And we followed them up over a 10-week period and beyond. So a bit more about the actual singing groups. So the programme that we evaluated is the community programme based in South London. But I just wanted to show how much this programme has been growing. And I think it's a real kind of testament to how evidence-based practices can then grow and be implemented based on having the evidence that they're working for different people. So they've been able to fund singing groups in hospitals with mother and baby units in Slam and central northwest London. They've been able to run an online singing programme as well for mothers across the country. So that takes the scope outside of London. And they've also been involved in some international training, so a project with the WHO to implement these groups in different countries, including Denmark, Italy, and Romania. And the most recent study, the most recent program is looking at whether this actually is helpful to fathers and fathers who are struggling with their mental health after having a baby, having a new baby. So obviously the talk is going to be a bit more about the ingredients of these programs. So I thought some photographs of what it actually looks like would be helpful. I do have some videos, but I'm not going to play them because they can be a little bit clunky. So there'll be a link at the end for you to look at them. But they're really beautiful videos and they just really show what's happening in these groups and how these groups are run. So you can see here that, you know, the environment is pretty relaxed. It's very colourful. Basically, the groups are done over 10 weeks of singing. They are 1 hour a week, and mothers come along with their babies. And the average group size is sort of 8 to 12 dyads. We've also got some photographs there of the researchers collecting cortisol samples from the babies, which were collected before and after the singing sessions. And in terms of the clinical effectiveness, so we assess mothers' mental health at baseline at week 6, so midway through the intervention, again at week 10, which was the last session of the intervention, and then at longer time follow-ups at 20 and 36 weeks. So this figure shows the change in mothers' depressive symptoms on the Edinburgh Postnatal Depression Scale from the start of the study all the way through to week 36. So we found that mothers in both groups experienced a reduction in depressive symptoms during the intervention period. But once that period of active engagement with the research and with the singing groups ended, mothers in the singing group continued to significantly improve at weeks 20 and 36 compared to the control groups. So we can see the control group plateauing a little bit towards the end with some mild improvement by week 36. In terms of the implementation effectiveness, so the quantitative measures were around collecting questionnaires of acceptability, appropriateness, and feasibility. And mothers were asked to rate on a scale of 1 to 5, where 5 was the most acceptable, appropriate, and feasible, and 1 was not at all acceptable, appropriate, and feasible. And we asked mothers in both the singing groups and the control groups to complete these questionnaires. So we found at week 6, which is when we took the measures, so halfway through the intervention, that mothers in the singing groups rated Melodies for Mums as significantly more appropriate, acceptable, and feasible for the management of postnatal depression symptoms than those who were attending other signposted community activities. So that's the quantitative findings. That's the sort of bedrock of the main trial. So my job really as the qualitative lead for this project was to come in and try and understand how and why these singing groups were having these impacts on the mothers. Why was it acceptable to them? Why was it feasible and appropriate to them? And I think it's just useful to sort of highlight the importance of identifying these ingredients and mechanisms when we think about implementation research, because it really helps us to understand how and why programs lead to their intended outcomes. And this is useful because it can inform design and delivery of programs. It can help people think about how to tailor and adapt their programs to different populations or to support specific health conditions. And ultimately, it helps to roll out a program, make it replicable, which is really important for funding and sustainability, and particularly in a climate where a lot of these community programs rely on fundraising, on commissioning, and really defending and presenting a case for their activities. So if they can demonstrate how these things are working, it sort of adds to that sustainability in the longer term. So the first question we asked was, what are the key active ingredients of the Melodies for Mums singing programme? What was it that affected its perceived acceptability, feasibility, and appropriateness? So we conducted qualitative semi-structured interviews for this part of the project with both participants as well as professional stakeholders. So that was people who were delivering the activity, but also people who were referring into the activity. So people like healthcare professionals who were signposting women into the programme. And just a little bit more about ingredients and active ingredients. So when we think about this term, it's mainly got its origins in pharmacological research. So it's often used to describe the elements of a drug, for example, that are responsible for its therapeutic action. But over the past few years, research into active ingredients has also become much more popular within non-pharmacological health research. So specifically around behavioural science and implementation science, really trying to understand what it is that forms or defines these interventions. And we often see this in relation to complex interventions where there are multiple components within a programme. And arts creative health programmes are no different. They're made up of lots of different ingredients. So we did some mapping work to develop a framework which could help people who were developing or evaluating their creative health programmes to really sort of record what was going on in those programmes. And we structured this around 139 potential active ingredients within 3 overarching categories. So these involved contexts, people, and projects. So the contexts of the creative health programme relate to the activity setting, the environment in which the activity is taking place, the resources that are needed to deliver that particular programme, the surroundings that make up the situation, what is needed to make sure this is delivered, as well as how do people find out about it, how are they referred in to the programme. In terms of people, this is about the people who are needed to deliver the arts programme. So what are their skills? What are their knowledge and their background? Who are they? But also the people who are taking part in the activity. Do they have shared experiences? Are they from a diverse background? So who is it that needs to be in the room for this activity to take place? And then finally, we have the project activity element. So thinking about the attributes, the qualities, the characteristics of the arts or cultural offering. So these are sort of intrinsic to the activity and its delivery. So a bit like, I'm sure most of you are familiar with the TIDIA framework for complex intervention. So it's very similar to that, but tailored much more towards creative health programmes. So alongside this framework, we have a worksheet that help people really think about what their offering is, as I've said, either when they're developing something new or they're tailoring it, or they're just wanting to take a step and think, right, what are we actually doing here? And it's really helpful for them to also think about what kind of outcomes they want to achieve and work backwards and think, so if we want to achieve a certain outcome, what kind of components might we need to consider within our offering? And the other thing that we have done is a kind of comparison worksheet as well. So this is an example that we've completed where we compared Melodies for Mums online groups with Melodies for Mums in person. So this just sort of helps give you a sort of eyeball of what ingredients are similar between 2 programs, what are sort of some of the similar ingredients and what are different ingredients. So you can make kind of a really sort of easy summary of what it is about a particular program that's the same or different. So elements in green were the same across the online and the in-person programs. So for example, the frequency and duration was the same, once a week for 1 hour. The elements in orange shared some, but not all attributes. So comfort and belonging within the environment was experienced by participants both in person, because the children's centres were experienced as comfortable and safe. But for those online, they were at home. So for most mothers, home was a safe and comfortable place for them to be taking part as well. And then those in yellow are the different categories. So, for example, the delivery mode was very different for the online singing groups versus in person. One of the biggest things was when women were singing online, they were muted, so they couldn't hear each other because it was quite chaotic sometimes to have everybody singing online together. Whereas in person, this is a really core ingredient that mothers can do rounds together, they can sing together, they can hear each other. So that was a very different ingredient of the online versus in person. So going back to the photographs that I showed at the beginning, you can start to see some of these ingredients now much more in practice. So as I started to mention, I shouldn't have done it first because this was for this bit, but as I started to mention, you can see the colourful environments, the context. So the context is colourful, it's relaxing. Women can either stand up, they can sit down, they can be on the floor, they can be on chairs. There are cushions and toys. And women are sitting and positioned in a circle so they can look at each other and respond to one another. In terms of the people, you can see mothers and babies coming to the groups together. You can also see in the top right photograph, 2 staff who have Breathe t-shirts on. So every group is supported by a musical lead who is a professional singer, a professional musician, as well as a Breathe administrator or a Breathe supporter who is trained in safeguarding and working with vulnerable people. So they know what to do if a mother needs particular help or is distressed in the group sessions. And then in terms of the project, you can see the instruments, you can see in the bottom left-hand corner, women are singing to their babies, they're using hand movements. And again, there's a variety of positions that people are singing in. So what were the results when we spoke to people? So we spoke to 22 participants and 15 professional stakeholders. We used framework analysis and we mapped some of the common ingredients from Melodies for Mums to the context, people and project ingredients in the INNATE framework. And we identified 3 context ingredients, 7 people ingredients, and 6 project ingredients that all seem to facilitate implementation success. So where experiences were largely positive, I've presented those in white bold text in the next few slides. And where challenges and suggestions for improvement were also identified, these are presented in black italics. So I'm just going to share some examples of each of these ingredients with a quote to support some of them. So participants mainly identified contextual barriers, actually. There weren't any findings that were purely positive in the contextual category. So there were some barriers around the distance and the travel with a new baby. That can be quite challenging. So coming out to the children's centres, even though they were in people's local areas, there was a lot of interest outside of the local areas. So some women were travelling quite far. The other barrier was the time and day of the sessions. So some women had other children and it was really difficult to fit it around their other children's routines, but also their own babies' routines around feeding and nap time. But most mothers acknowledged there was never going to be a perfect solution for everybody. Just the nature of having a child was very unpredictable. So most women felt they could get around that and accept that. In terms of the recruitment and advertising, we had both positive and more negative findings. So most women found out about Melodies for Mums through word of mouth and social media. So this might have missed mums who were more socially withdrawn or not engaging with technology. On the flip side, though, the marketing was really appealing to mothers and it really helped those that maybe lacked confidence actually come forward and want to take part. So this is a really lovely quote of a mother who said she really noticed on the advert that it said something along the lines of nobody will be forced to sing by themselves. She found that really reassuring and really clever and it hooked her in and made her want to come. And then on the flip side, for the referrers, I think sometimes people make referrals to these kind of programs and then they never hear anything more. So actually having a feedback loop where the referrer knew that the person had had a positive experience, then put it in their mind to refer people again. So if they saw other mothers in similar circumstances, they were more likely to mention this and refer them on. So in terms of the people category, so shared lived experience was really important to the mothers, both in terms of postnatal depression, knowing that other women were having similar challenges, but it was a shared and unspoken experience. It was really important that women didn't have to talk about it and that they were there to do something else, but they acknowledged that they were there together and facing these challenges together. And of course, just the shared lived experience of being a new mother. So all of the babies were 9 months or younger. So everyone was fairly new to being a parent. The skills and values of the music leads were really important. So not just the amazing musicality and the professionalism of their craft, but also their skills around seeing women that were struggling, making sure that they were adapting to build confidence. So this is a really lovely quote from a stakeholder who she's a music lead, and she talks about encouraging mothers who were less confident as singers, showing vulnerability herself. So if she messed something up, the group could laugh together. So having those skills, it's not perfection. It's, yes, the music is important, but we have to acknowledge the different skill levels in the room. In terms of the structured social time, most mothers really valued this. However, many of them said they did want more time to socialise. And this was a bit of a tension with the singing leads because they wanted to put the music at the focus as the centre of the activity. So getting the balance right could sometimes be a bit of a challenge. Similarly, there were some barriers around the unstructured social time. So the Breathe staff set up a WhatsApp group so women could stay in touch outside of the groups. And this was pretty successful, but some mums did report difficulties taking forward these relationships outside of the singing group. So more might need to be done to nurture those relationships and make sure they continued. And the small group size as well. So as I said previously, most of the groups are 8 to 12 dyads, but because this is a research study, recruitment was quite slow at the beginning. And so we had smaller group sizes of sort of 3 to 6 women. So in those groups, while it helped foster social connection, some of the women did feel a little bit exposed and felt that the groups were too small to enjoy the singing properly. The shared mother and baby activity was again really key. To have this experience of singing to your baby really helped bonding. So this mother talked about before going to the singing groups, she wouldn't be able to sort of communicate with her baby very well. So she says she wouldn't look at me or make eye contact, and that made her nervous. But she says, as soon as I went to Melodies for Mums, I sang at home with her and she would make eye contact, and that was amazing. And then finally, having this additional support staff just really helped mothers be relaxed. It made them feel like they could fully engage in the singing group. So this is just an example of a woman talking about how important that extra support was. And I think the really key thing about this quote is the last bit, which she says, the staff were helping her. It made such a massive difference to me because it made me feel like I could ask for help. And it wasn't something she had been able to do before. She felt like she couldn't ask anybody for help before. So then she was able to think about that and take that forward. And then in terms of the project ingredients, so the weekly sessions, the routine, the rhythm of the 10 one-hour sessions was really important to build that routine, to get to know one another. Having that flexible and adaptable structure was also really key. So this is a really nice example of a singing lead turning up to a session. She's got a session plan. She's ready to go, but she looks at everybody. They're exhausted. So she changes the energy and she sings songs to the women. She lets them lie down, hold their babies, relax. And the delivery of the session just completely changed in response to the mood of the room. The difficulty level of musical activities was, again, both positively received, but there was just some barriers. So most women said it was easy enough to do, especially when you're sleep deprived, you're focusing on a child, but it's also difficult enough that it brings you out of yourself. So most women said the balance was just right. But others felt it quite challenging to remember the lyrics and learn something new. So there were some suggestions around having more tools to remember, so like singing lyric sheets or aids to remember some of the songs. The diversity of songs was something that came up a lot around both how they were in different languages. There were songs for energizing, for sleeping, to interact with the baby. And this is really important so that it could be tailored to help mothers bond with their babies in different situations. So it was also really helpful to sort of help women process emotions because some of the songs were very emotional, all about mothers. So you hear this participant talks about singing and feeling herself welling up because the songs were just so beautiful. And the final project ingredient was the element of singing in a group rather than, going to sort of a more individualized session. So this mother says how this made her feel relaxed and calm. There's something about singing when you're doing it as a group and you have to focus on what you're doing. So it really helped women to switch off from negative thoughts. So you can see, hopefully, some mechanisms creeping in here. It's not just the ingredients, because some of the mums also talked about why these ingredients were really important to them. Which leads me into the next section. So the next bit of the project was to look at the mechanisms of action by which taking part in Melodies for Mums leads to improved mental health. So for this, I conducted focus groups with participants. So I went along after their last singing session. So that was week 10. And after they'd done their singing, we sat down and we talked about what it had been like. This was hugely challenging. You can imagine a room of 10 mothers with 10 babies under 9 months old, trying to capture those conversations on my little audio recorder. And it was also quite daunting, given what I said earlier about shared lived experience, and it being really important that mothers could come and not talk about how they were feeling and just sing. And then a researcher comes along and asks them to talk about how they're feeling. So I was really nervous about that, but it was actually quite cathartic. And a lot of the mums, after the discussions, felt like they'd got to know each other a little bit better and really appreciated some of the honesty and sharing of the experiences and the challenges. So for this piece of work, I've been using the multi-level leisure mechanisms framework. So this is a cross-disciplinary review of the literature, which was used to develop a theoretical framework, which identified over 600 potential mechanisms that are triggered by engaging in leisure activities in particular. So this sort of helps us to explain why engaging in leisure activities impacts our health. So these mechanisms can be categorized as psychological, biological, social, and behavioral. And they also operate at individual, group, and societal levels. And it's rather messy, this diagram, but it acknowledges that mechanisms might not operate in isolation. They might also trigger one another. So, for example, I attend a dance group, I meet new people, so that might lead to increased social connectedness. Then that might motivate me to attend. So the psychological and behavioural mechanisms might be triggered, both in terms of motivation and also attendance. And then that in turn can lead to improvements in my physical health. And that's just a picture of the paper. So this is work in progress. So I'm analysing the data from 97 participants who took part in one of 20 focus groups. And I'm using content analysis. So I'm starting with the framework mechanisms and using those as the codes within the data. Sometimes I'll adapt them because for example, one of the mechanisms is increased self-confidence, but sometimes mothers talk about specific examples of that. So increased self-confidence about going out on their own, increased self-confidence about interacting with their babies. But generally, I'm using this framework as a mapping tool. And there is some scope if I think there's something that's not in there to add a new mechanism. So I've analysed 7 of the 20 focus groups so far, and already I've identified 54 preliminary mechanisms that are occurring when women take part in these groups. So the most popular mechanisms so far are behavioural, shortly followed by psychological, social. And as expected, we're not getting a lot of biological mechanisms from qualitative research, but we do have all of the data on the cortisol samples, and there's a really strong mechanistic argument being had there that actually, after the singing groups, women's cortisol is reduced. So I'm not going to go through all 54 mechanisms. I'm just going to give you one example of each type of mechanism that I've identified so far. So the first one is the psychological mechanism of improved attention-focused emotional regulation. And this refers to the regulation of someone's emotions via techniques that deploy someone's attention. So that could be because the activity helps them to concentrate, it distracts them, or it suppresses negative feelings. So this lady talks about singing as stress relief. They go into the singing groups for that hour. They don't have to think about all the other stuff that they've left at the door. So as you can see, I think in one of the previous ingredients, this was coming out. I think it was in terms of the communal singing, the diversity of songs and the level of difficulty of the songs as well. A social mechanism is around increased social network. So there's lots of social mechanisms going on when women are taking part in these groups. So just less loneliness, more social connection. This one specifically is sort of the number of people that's it's helping them increase the size of their networks. So this lady talks about making new friends, building her tribe, and having different pockets of support and connecting with different people. And hopefully their babies grow up together a little bit. In terms of behavioural mechanisms, one thing that's been identified is this sort of reframing of anticipation of forthcoming positive events. So having something to look forward to is really helpful for mental health. Something nice to do for the day, and not just going because it gets me out of the house. It's something that I'm going to go to which makes me happy and baby's happy. And finally, as I mentioned, we did measure cortisol, so we've seen that clear biological mechanism in action. But mothers did use language like endorphin rush. They talked about feeling energized. So we can look at that a little bit within this research. And then just some examples of mechanisms at the different levels. So at the micro level, as I've mentioned, the reduced stress hormones seem to be happening. There's reduced loneliness, improved mood. At the group level, there's a sense of an enhanced social solidarity. So women feeling sort of independent upon one another and enhancing the lives of each other when they're taking part in these groups. And also an increased sense of group self. So this collective self where people are creating something together. They're creating around, or they're sort of bouncing off one another with the creation of new songs. And then at a societal level, this is less easy to sort of get out of the interviews, but most of the mechanisms are at an individual level. But there is a little bit in there around women then going on to engage in other collective projects in their communities, because this has given them the confidence to take part and to do that work in their communities. So the next steps and challenge, and the bit where I'm at the moment, is trying to link the specific ingredients to the mechanisms. So as I've given some examples there, participants do talk about specific components of melodies triggering specific mechanisms, but sometimes they don't explicitly state it. So they might just talk about a mechanism, but it's in the context of the program as a whole. So I'm just sort of wrestling with myself about how much interpretation I should use when because I can see a mechanism and I can think, well, that seems really related to this bit of the program, but the mother hasn't said that herself. So there's some of that to unpick, really. And then the other thought that I've had is thinking about reconsulting the existing literature to back up some of the assumptions that I might be making about these links between ingredients and mechanisms. Or I might just choose to report on the mechanisms that are explicitly linked to the ingredients by the mothers themselves, where they tell me a particular program component has triggered something for them. And this is just going back to that original description of active ingredients that I talked about in terms of the drug versus melodies. And another really nice quote, just showing an example of enhanced social solidarity. So for those of you who've seen The Commitments, this mum says, it feels like the start of one of those films where these unlikely characters get together and go on to form a commitments type vibe. You have all this shared uniqueness of being a mum. You have battle scars and all of these things in common, and you've come together in a way that you can't really describe to other people. So to conclude, mothers seem to consider Melodies for Mums as acceptable and feasible and appropriate for supporting their postnatal depression. The people and the project ingredients were identified as key for implementation success. The contextual ingredients seemed to be more peripheral. As I mentioned, it was mainly contextual barriers that existed for some mothers. We can see a range of psychological, social, behavioural, and biological mechanisms being triggered that are responsible for this improvement in mental health. And hopefully the findings can help inform the design and adaptation of future creative mental health programmes. And I just want to finish on this final quote. I think this is a really lovely example of the longer term impacts of taking part in Melodies. So this was a mum who just talked about how taking part in the singing groups allowed her to reframe her perception of time and future events over this 10-week period. So she talks about it being transformative to everything. We were in this bubble of motherhood, the negative side, and a lot of times I was living in a parallel world. It's normal to be up at 3 a.m. when the rest of the world is asleep. And I felt I had the songs, a bit of company, and I knew I will be going out to Melodies for Mums on Tuesday. It might be raining, we will get there. Sometimes I'll probably be in my pajamas, clothes I haven't fully got changed into, but I knew I had to go. And I knew because we started in winter, I knew that after the 10 weeks that spring was coming, it was going to be a different season and we would have moved on to a different place. And that's just a QR code which takes you to Breathe Arts Health Research website. And there are loads of amazing resources and videos of this in action, which you can have a look at if you're interested. Thank you. Shall I stop sharing or shall I keep that up?
I'd maybe keep it up